I hope you're seeing the PPT now.
Yes, can see.
So these are the medicines for today. Six medicines, all are very small actually, even very specific in its action, not a polycrus like, but a very specific action. So we have Ranunculus bulbosus, Raphanus sativus, Ratanhia, Rauwolfia, Rheum, and Rhododendron. So the first one is Ranunculus bulbosus. You remember anything of Ranunculus bulbosus taken by Sir?
Um, Back effect of alcohol is very remarked,
Mm-hmm.
and the muscle pain. Is it chest, somewhere around
Yes,
chest?
yes, yes. Intercostal neuralgia or even
Yeah.
intercostal rheumatism. So these are the two. Anything more, Lenny? So
No, I
this,
just about to say the nerve.
okay. So these are the two important areas where this drug is indicated. And also there are cons also, but the most important when we hear about ranunculus bulbosus, one of the most important symptom is indicated in drunkards for their hiccups like symptoms, and also for the intercostal neuralgia, intercostal rheumatism. Uh, it's almost a specific for intercostal rheumatism. So going to the common name, it is also called as buttercup or bulbosus buttercup, St. Anthony's turnip. Belonging to the family Ranunculaceae, all parts of the plant are poison. The toxin can be destroyed by heat or by drying. The plant actually produces some acrid juice that can cause blistering of the skin. Usually seen in meadows, lawns, dry pastures, and habitat. Mostly they have given the European, the UK places. And homeopathic preparation, we take the whole plant, its tincture. So the causation in ranunculus bulbosus, it is due to anger. The slightest anger could result in symptoms of trembling and also dyspnea. But when we come to the symptom proper, the trembling and dyspnea, it's not much characteristic. Dyspnea can be seen because if intercostal rheumatism is there can be some pleural affections. As a result, breathing may be difficult. But it doesn't mean like ranunculus is indicated is in a dyspnea as like that of ASAL, calicup, sorinum, not the COPD conditions, but when pleuritic affections are the pleurisy is being affected, and then there is a pain. If there is pleurisy or the pleural layer is affected, when the patient is taking inspiration, there will be a pain in the pleural region. The patient will feel that pain. So, because of that, the patient will be reluctant or having difficulty to take breath, and that related dyspnea, not a COPD or the asthma as like we see in other drugs. Then change of temperature or weather, it is an important causation. Alcohol, more than injury, alcohol will be one of the most important causation. Clinically, as Lenny told, alcoholism and pain in chest region, any pleuritic adhesion, pleurodynia, intercostal rheumatism can be given. For chilblains, like agaricus, for the chilblains we can think, cons or the conditions of warts, delirium tremens, especially the people who are drunkard or due to alcoholism, and also hiccup. Hiccup also, which is seen in alcoholic people. Then this is mainly indicated for neuralgia or the pain along the nerves. So this is also indicated in herpes zoster. Later we will see that the patient may have vesicular eruptions. So this vesicular eruptions with neuralgia is a characteristic feature of herpes zoster. So we can think about ranunculus bulbosus in herpes zoster and also for writer's cramp, especially the people who are professional writers or what is that typewriters. Nowadays, the people who are typing on the laptops, the piano or the pianist. For them, it is like those conditions also, ranunculus is a good remedy. So, according to Alan Skeenot, this is one of our best remedy for the bad effect of alcoholic beverages. So, after to the alcoholic beverages, if the patient is affected with spasmodic hiccup or delirium tremens, ranunculus is one of the specific. This can be given for day blindness. The patient will be having a mist-like sensation, a misty sensation before the eyes, with pressure and smarting pain in the eyeballs. Can you say me some other medicines for day blindness? Any other remedies? It's a snake remedy. Snake remedy with starting with B. It's a specific actually.
Starting with what?
Huh?
Starting with what?
Starting with B, alphabet B, and it's a snake remedy.
Botulinum?
Botulinum. How did it become a
Botrons?
snake remedy?
Botrons?
Yes, yes, botulinum. Botulinum is actually the fungi, right? An adult, yeah, fungi. Clostridium botulinum, the
Cannot hear.
no, fungi, a nosort from the fungi. Any other remedy? Actually, Bothrops is a specific. For day blindness, we do we have any other remedy? Phosphorus, after to that, a complementary, which is the remedy starting with S. Whenever we say phosphorus, that remedy will be following after.
Alicia?
Yeah. And even lycopode. However, the specific will be ranunculus and also Bothrops. The other remedies are also the whatever I told. Then there will be muscular pains. Let me come in between. Muscular pains, because we told that it is good for people who are doing needlework, typewriting, piano playing. So there will be muscular pain along the margin of the shoulder blades in women who do the sedentary employment with burning pain. And such a symptom we can see even in case of actia racemosa. If you remember, actia racemosa or simsifuga, they also have, and their pain is along this shoulder blade and also along the muscle belly also, a burning type of pain, but that will be usually left sided. But here we have not mentioned the side, uh, but ranunculus bulbosus also have that similar symptom of that of actio racemosa. People who are doing the sedentary works. Even magnesium force, MacForce, that is also having this mostly writer's cramp actually, uh, not this along the shoulder blade. MacForce is having writer's cramp. Then do you know what is the symptom of actia resmosa is having such a muscular pain? Do you know what is the symptom of actia spicata? The most important symptom of actia spicata. Have you studied actia spicata?
Yeah.
Yeah. Do you remember?
Yes,
It's a single symptom. Yes. See. Okay.
The
Just.
spicata, spicata, the ACTA, that one, is it? Rheumatic pain, I think.
Yeah, rheumatic pain, but a specific place is the.
I can't remember.
Especially the small joints, the finger
Small joint.
joints, the ankle, the wrist. But still, when we go to the more specific, actia spicata is something that you have to remember in case of rheumatism of small joints, the finger joints especially.
Okay.
Uh, so when it just actia rhizomosa came up, I just asked you about actia spicata. So here the pains, it can be a stitching pain like that what we learn in case of calica and also bryonia, sharp shooting type of pain. So many remedies. Neuralgic, more important, myalgia or rheumatic pain. It comes in paroxysm. So it doesn't matter what exactly the nature of pain is. It can be a neuralgic pain along the course of the nerve or myalgic, the muscle belly may be affected, or the rheumatic type, which comes in paroxysms. And that pain is actually brought on by the atmospheric changes. We can see such a symptom, even the other remedy we are going to discuss today in rhododendron. Rhododendron also we see that symptom. Uh, the pain may be inflammatory and that depends upon spinal irritation, which is in similar to agaricus also. There can be pleurisy or pneumonia from sudden exposure to cold or while overheated or vice versa. A symptom that we can see in aconite and also arnica. Even what is that? Sudden exposure to cold, a dull camera, rustox can also come over there. Then intercostal rheumatism, where the body will be having that sore bruise feeling. So this sore bruise feeling is as characteristic as we learn arnica. So when we remember about arnica, someone says you say about arnica, one of the feature that will be coming out from you will be that sore bruise feeling. And we have other drugs also like Rustox, Bacteria, Pyrogen, with this sore bruise feeling. So other remedy which is characteristic of that sensation is ranunculus. But this is more in the chest region, and that is due to the aggravation from or due to exposure to wet stormy weather as like in rustox. Can be given for corns, the thickening of the skin that is seen under the foot, which is very sensitive to touch. It will be smarting and a burning pain. So one another remedy for the corns is salicylic acid. Do you remember any other remedy, any other specific, a common specific for corns?
Corn.
Hmm.
Uh, Actually, sulfur, someone had got well from sulfur, but I'm not sure whether it's a
Yeah,
main
sulfur we
thing.
can give, definitely, definitely. I mean, any skin condition we can give sulfur. But I have put here the two alphabets. So now from that, can you get
Oh, yeah, uh,
any guess?
antimonium, Rhodo.
Rhythm.
Crude. And in crude, so this will be the specific salicylic acid, antium crude, and ranunculus for corn conditions. The specific, okay, you can give, even I have given silesia also. Sulfur is also indicated. If the medicine we get indicated, we can go for that. But these are usually the specifics. Then herpes zoster that we told already. Another name is shingles. So there will be intercostal neuralgia either before to it or follow to it or along the course. And these vesicles will be having a bluish appearance. Aggravation from contact, from motion, any atmospheric changes, especially wet, stormy weather. So this was a case of corn. Actually, I treated over here. There was much swelling and hardness. It was changed up to this situation. However, however, it didn't stop because maybe because of the person's job related. I don't know. Though it got this much ameliorated and I felt relieved, it again aggravated. I mean, it was not aggravation; it was a relapse of condition. So at that time, I initially I was giving anti-crude. No, not anti-crude. I gave initially lycopodium. The person was having a lycopodium constitution, and we don't have much potencies over here. So I got it only until lycopodium 1M. And then I shifted to Silesia. Actually, I didn't go for salicylic acid or anticrude or even ranunculus. I went to Silesia because the surrounding area that which you see the swelling, it was becoming very soft, like some pus being accumulated, but not pus actually. It was very soft and painful. So that was the reason that I gave Silesia to the patient. So I gave Silesia 30 and 200. So then only it became like this. That swelling being gone and patient much relieved by that. But after to that, when it again the skin again started growing up, um, and again that swelling with that softness came up. I gave Silesia 1, but after that the patient didn't show up, so I don't know what is the present condition. So yeah. Now, ranunculus bulbosus, actually what we learned in Ellen's, the first two slides that will be the most important symptoms for exam basis, the intercostal neuralgia, the aggravation due to the change in weather, then the neuralgic pain, the burning pain, intercostal rheumatism, the counts, that will do. But going further, in some of the textbooks, there is a pusillanimity or lack of courage or determination, a kind of timidity in these persons. As such, for exam purpose, ranunculus mind doesn't matter at all. But here you can see there is a similarity to pulsatilla, and they're quite restless or inquietude, aggravation, especially towards evening. They have a fear of ghost in evening and they desire not to be alone. This mind is especially given in Kent actually. But when we are prescribing, because ranunculus is a specific, when we prescribe it for all these conditions, neuralgia or even the intercostal rheumatism or the counts, because we go as a specific prescription, we exactly don't go for its mind actually. But they have a irritable, quarrelsome nature in the morning. There can be much oppressed sensation as if they are suffering some unjust treatment from the authority associated with much weeping. So sometimes symptoms much similar in case of pulsatilla. There can be a loss of ideas, difficulty in meditating, vanishing of thought, and obtuseness of intellect. In case of boric, whatever the symptoms that we told, especially the action. Yes.
I just want to ask, I see the advertisement at said that liquor student free.
Yes.
So I'm liquor student, so how to get a treatment?
Actually, now I'm the only doctor and I'm actually taking online class. Can you come later after 5 p.m.
Or
or even tomorrow?
tomorrow at
It will be from 8:30 to 5. There will be there anytime
okay, I will at 3 I think.
tomorrow.
Yeah.
Yeah, sure.
Actually, what the service here?
It's actually homeopathic treatment. We don't give allopathic medicines.
Um,
Have you taken homeopathic medicines before? Okay. What's your complaint?
sorry,
What is your complaint?
I just want to try.
You don't have any disease.
Yeah.
Then how you will try?
Sorry.
You need to have some complaint. Then only you will know.
Okay, okay. Thank you. So I can try. I can try.
If you have any disease, you can come up. There is no meaning in taking any medicine when you don't have any disease.
Okay, thank you.
Uh, so, in case of boric also, whatever we learned earlier, it especially act on the muscular tissue upon the chest walls like a pleurodynia, bad effects of alcohol, delirium tremens, spasmodic hiccup. I'm just repeating these symptoms so that you understand in the drug which are the symptoms that you need to give importance to. Shock stroke doesn't matter. Chronic sciatica doesn't matter. Then, yeah, day blindness. Okay, that medicines we have already discussed over here, but we can put medicines for night blindness. For day blindness, we have put the medicines, various kinds. For night blindness, you know the medicines for night blindness? Any guess? I'm just typing the initial alphabets. Whichever you get, you can answer.
Is P pulsatillamus?
No, it's a um, alkaloid. No, no, not alkaloid. It's a plant actually.
Hyacinthus?
Yes, one is hyacinthus. So I'll have to type the other H also. It is more than hyosamus. There is another H that is more important. But nevertheless, hyosamus is also an indicated remedy for night blindness.
Helleborus?
Yes. Close the bracket.
Lysostigma?
And other things. This one, maybe you won't say this is exact. Huh? Okay. Cadmium
Ah, okay.
salt. This is exactly as specific. And then
Stramonium?
Belladonna?
stramonium, yes, it can come stramonium. But if I write stramonium, I need another S also.
Is the B for belladonna?
Yeah.
Okay.
This is the alkaloid starting with S.
Strychnine, something like that.
Yeah, strychnine. And it is the alcohol, I mean alkaloid that is present in which medicine? Strychnine. I'm not sure about the spelling, so stop over here because I'm not sure about the spelling. And strychnine, in which it is the alkaloid of which plant? Do you know? Strychnine. The alkaloid of Nux vomica. Even Nux vomica is a good remedy for night blindness. So it's got such a lot of remedies. Among this, if we go for the specific, that will be physostigma, cadmium sulf, strychnine, and Helleborus. So, though we are studying this remedy for day blindness, when we go to J.H. Clark, we'll see that this medicine, ranunculus, is actually given for both the condition. Can be given for day blindness and also night blindness. So it depends upon the symptoms the patient is showing. According to Clark, this can be given for both the day and night blindness. So other symptoms, there's along with the eye, the day blindness, the person will be having misty sensation, which we already saw. The herpes and vesicles, which is generally present on the skin. In case the patient may be having it in the cornea also, and that might be the reason for the blindness. With intense pain, photophobia, and lacrimation. And in chest, the bluish sensation in the sternum, the ribs, intercostal spaces, and also in both hypochondria. So along the liver and also the spleen region, there will be pain. Intercostal rheumatism and the chilliness in chest is aggravated when walking in open air. That cold air inhalation is going to cause a problem for them. Then the pain that we saw in people or the women who are doing the sedentary employment, muscular pain along the margin of the shoulder blade. The skin with burning shingles, the bluish colored corns that is very sensitive, or horny skin. Fingertips and palms are actually chapped, like what we learn in petroleum, graphitis, silicea, like that. Then modality is aggravation from open air, from motion, from contact, atmospheric changes with stormy weather, evening. Cold air brings on all sorts of ailments. We have discussed that all these modalities. Then it is incompatible with sulfur and staphysagria, and antidotes bryonia, camphor, and russtox. So if you see, it is coming in some of the other slides, it is coming. We saw that there is intercostal rheumatism, which is aggravated from motion. And that similar symptom we can see in bryonia also. In bryonia also, there is a sharp stitching type of pain, even in the chest region, because bryonia is also indicated in pleurisy condition, in pneumonia condition, when there is cough. So that symptom we can see even in ranunculus. Uh, and both are having aggravation from motion. But then how to differentiate both the drugs, we'll see later. And then another comparison is with Russtox. Were in Russtox also this aggravation or the complaints that come up during wet, stormy weather. And even in Russtox, we have it is greatly indicated for rheumatic complaints. So a similarity comes with Russtox also. So because of that similar remedies, it is antidoting each other if you are not carefully selecting. So ranunculus bulbosus, as in J.H. Clark, in one of the prover, when they applied the juice of this plant, it resulted in long-lasting and recurrent vesicles on the fingers. And these vesicles had a bluish color, and that shows the drug feature, the vesicles, the bluish color, hence indicated in shingles. And also the horny or the thick callus nature of the scabs. There is aggravation during inspiration, which I was saying you. So there is a general sensitiveness, and that aggravation during inspiration is a grand keynote of the remedy. Another keynote is sensitiveness to touch, especially that sore bruise sensation, as what we saw in case of arnica. So in Clark, it has been mentioned that Herring calls this medicine good for hemorrhagia, and that is actually a condition which indicates both day blindness and night blindness. And he had given or treated hemorrhagia in a woman during her pregnancy and also in her 3-year-old son. So we can say this medicine is indicated in both conditions, depends on the symptom similarity. This also we said we saw in boric, there is pain along the both hypochondria. So there is pain in liver and spleen region, aggravation by touch. Then a remedy for writer's cramp and other professional neurotic pains, like what we told, the typewriters, the pianist, etc. The pain comes in jerks and shocks in the right forearm between thumb and index finger. So there is a case that was reported by Dudgeon, which was cured by ranunculus. So a lady of 27, 3 weeks after her confinement, after delivery, she went for a drive. It was very cold and the accident occurred. And this frightened her. So we got the ailments from the cold exposure and also getting frightened. In the evening, she had a slight rigor or chilliness, complained of pain in the left side along the ribs. 6 and 7 ribs they are seeing, but along the ribs. Aggravation from the slightest movement, amelioration sitting, rather bending forward and leaning a little to the left. Pulse was 120, no heat of skin, no signs of lung or pleural involvement. So initially she was given bryonia and later to that arnica, but there was no relief. For 2 days, the symptoms was growing worse. And this symptom was very characteristic. The patient had to be propped up with pillow, leaning forward and to the left, a head resting on her breast, not daring to breathe at all. So that much movement aggravation was there. That might be the reason, and also the exposure to the cold that and the intercostal rheumatism that initially bryonia was prescribed. But seeing no change, and even with arnica, no change, the ranunculus bulbosus 1 was given, and that relieved her in 10 minutes. Yeah, it is in Kent that I told the mental symptoms are coming up. There is a great depression, desire to die, fear of ghost, confusion of mind. But one of the most important symptoms that I liked over here is even this one, because of its exposure that we already saw the vesicles being produced on the skin. Many times, according to Kent, it is mistaken for rust poisoning. So it is a rheumatic remedy also similar to Restrox when the chest muscles are involved. Pain in the spinal nerves or pleura or costal muscles, and that will be always associated with soreness. So don't forget the soreness in case of ranunculus. And now here we come. It is sensitive to motion as like bryonia, but and to the cold damp weather as like to dulcamida. But in bryonia, um, the sudden weakness even to fainting in bryonia. Okay, there is sensitive to motion that is aggravating from the. But in bryonia, there is another symptom. The patient get ameliorated by pressure. But in case of this remedy, ranunculus, the pressure is going to aggravate. So that is one feature how to differentiate bryonia and also ranunculus. Both are having intercostal rheumatism from the change in weather and also that stitching type of pain, motion from aggravation. That would be the similarities. But in dissimilarities, so what make both the drugs to differentiate is in case of bryonia, there is amelioration from pressure, and in case of ranunculus, the patient can't bear any touch or any pressure. Then, in case of bryonia, usually the aggravation is from dry cold. Coldness is there, but it is mostly dry cold. And in case of ranunculus, it will be the wet cold or the wet weather that is aggravating. So these are the two features differentiating bryonia and also ranunculus. This medicine ranunculus has got sudden weakness and it has cured even epilepsy. Has complaints from fright and vexation, as we saw in the case of that lady getting frightened. Complaints are worse in the evening after any change of weather, especially from warm to cold. So cold air, cold open air, that is going to be the problem. It brings on headache, rheumatism, or whatever the complaint you name it, especially from cold exposure with that sore bruise sensation. Can think about ranunculus. In case of Lippe, he had given importance to the bad effects of alcoholic beverages. The symptoms we are told shocks throughout the whole body. Doesn't matter even if you forget it also. Don't forget the sore sensation, burning and stinging pains as like of epis. Like a inflammatory condition. That's what they meant of inflammatory condition. The vesicular eruptions, shingles, where it is preceded and followed by intercostal neuralgia. So another remedy for us in that condition will be mesaria. Then day blindness and also for delirium tremens associated with drinking or alcoholism. Can you say me other remedies for delirium tremens?
Bella? Belladonna? Page.
Hyoscyamus.
Yeah. Arsenicum or agaricus, I think.
Again. Well, hyos is then
Stramonium. I confused before. I have case which I don't know Hyoscyamus or Stramonium should be used for the high fever for 5-year-old boy. So in the end I chose the correct one, the Stramonium.
okay.
Because of the delirium, yeah. I choose the
So
wrong one at first.
the boy was having delirium also.
Yeah, during fever.
Okay, okay.
He just wake up and talking like haunted lah, the mother said.
Oh, great.
To them it's not
So
delirium, they say haunted.
was it a recent case, Lenny? Can you explain the case?
Sorry?
Can you please explain the case if it is a recent one and if you remember? Can you explain the case?
About 1 year ago, is a friend of mine. She suddenly called me middle of the night and she said her youngest son was haunted. She asked me any cure. So I asked her what happened and she said high fever, very high, 39.9, 40, 40.1 like that.
Mm-hmm.
And then I asked whether got convulsion. She said no. Then she said delirium is the most symptom that she can tell because the son is sleeping and suddenly like walking in the dream, but not really because he is talking.
Mm-hmm.
And the way he talk is like not him.
Okay.
So to them they believe that something has like haunted. So I thought it's Hyoscyamus because they cannot give me any other symptom.
Mhm.
Yeah. So I gave Hyoscyamus, but then no effect. After 4 hours also no effect.
Mhm.
So I go to the house again and I gave Stramonium.
Mhm.
And immediately after Stramonium, the boy have convulsion. So I was so worried.
Mhm.
Yeah, but then after that, immediately, I think 10, 15 minutes, settle down with a lot of sweat, and then the fever go down. And the boy awake lah, like awake.
Okay.
But the
So which
process is
potency?
quite terrible because quite frightening the case to me because Stramonium, yeah, high fever.
Yeah. So
From
which
haunted to
potency did you
convulsion.
give?
Which one?
Which
200
potency?
C.
Okay.
Uh,
And how
200 C.
many doses before to which the boy had convulsions? How much
Only
dose?
one dose, one dose.
Only one dose and it produced the convulsion. Maybe it was
Yeah,
lying incipient, and when the right remedy went, the symptom just came out.
yeah, but at the moment convulsion, I thought, oh my God, wrong again. I thought it's a wrong remedy. Then the next I think of is belladonna, but then luckily it's the correct one.
Yeah. Okay. Great. Okay. So thank you for sharing that case. So going back to Lippe, the intercostal rheumatism, we don't have to mention it. We have already discussed. And hiccup in drunkards. Yeah. It is here where the differentiation between bryonia and ranunculus comes. Bryonia wants the pressure on the suffering chest to keep it still, while ranunculus bulbosus cannot bear any touch or pressure. Bryonia is worse in dry cold weather and ranunculus bulbosus in wet weather. Modalities, so many other alcohol, the cold open air, motion, any type of contact, atmospheric changes, especially the wet stormy weather towards evening, and also inspiration, which is the grand keynote. Amelioration from rest, just like bryonia, from warm application, because this is having aggravation from cold and also in warm weather. So the next remedy is Raphanus sativus. Anything you remember about Raphanus? Have anyone given this remedy, Raphanus?
No, not me, not me. No use.
I didn't get you, Vinod. What did you say?
Did you ask if we have used it? No.
You are not given.
No, not
Not
given it.
even that. I think learned before, if I'm not mistaken, is something related to pain also. Chest pain that extend where already? Chest pain extend to
Yes,
the
chest
back.
pain is there. Yes, sir. But not as characteristic as like that of ranunculus. It is there.
Yeah.
And then one of the other important symptom is the flatulence. It is called incarcerated flatulence, as like it is struck somewhere. It is not going up or down. So that condition. And then for hysterical women, so in hysteria, they have that globus hysteria or something ball-like sensation that is coming from the abdomen to the throat region. So that are the most important features of Raphanus sativus. So it is the common name is actually radish, belonging to the family Brassicaceae or cruciferae. The fresh radish juice revealed the presence of hepatoprotective sulfurated compounds, phenols and terpenoids. It reduces the cardiovascular risk, also has got anti-inflammatory and anti-cancer effects. For homeopathic preparation, we take the tincture of fresh root immediately before flowering or even the tincture of whole fresh plant. So conditions, this is mostly given as, can be also given in alcoholism as like ranunculus. Most of the drugs that we discussed today, there are a lot of comparisons between to each other. But the most specific will be the flatulence, pain in heel region, the hysteria. Then they have actually sexual, especially in females, the sexual intense desire or the nymphomania, menorrhagia and metrorrhagia, and for pemphigus also. Pregnancy, during that time, there will be toothache and yawning. But out of this, I think, no, only this much. Out of this, the most important in case of Raphanus will be the flatulence, then the pregnancy toothache off, or during pregnancy there is toothache, the yawning complaints, that is more important, also hysteria. So according to J.H. Clark, because Raphanus is not given in Allen's keynote, we have to study mostly the symptoms from Boric. And in Boric, it is mostly concise symptoms taken from here, though, mostly clinical symptoms. So you need to know the origin or some explanation to remember these drugs. So that's why we'll start with J.H. Clark. So this medicine was proved by Nusser or Nasser, and he proved both the garden radish and also wild radish. Garden radish is nothing but a cultivated variety of the wild radish. He took the tinctures. While the other prover was Curie, she did the proving in a woman with 15th and 30th dilution. So Nasser proved it in tincture and Curie proved in a woman with 15th and 30th dilution. And because it was a woman, the hysterical, mental, and uterine symptoms came out. So the most characteristic among them was that globus symptom. So the globe-like sensation or something like a ball is coming up. That is globus hystericus. So the globus symptoms are marked as with any other remedy. A number of balls ascend from abdomen to the throat. Now, this symptom, how they explain is so confusing. Difficult even to comprehend, but we can go through it, how the lady had explained that globus sensation. As if a hot foreign body goes up like a ball from the uterus and it stops at the beginning of the throat. So something very hot and something foreign like a ball is coming up from the uterine region and it is getting struck at the throat. And in the throat region, when it is getting struck over there, it feels like a morsel too large to be swallowed. And after that, it descends down to the stomach, not to the uterus, but to the stomach. And because it is very hard to digest over there, it lies in the stomach, difficult to digest, and leaving an empty sensation with hunger. But why I told that it is uh, very strange, because if something, a ball is going towards the stomach region and it is lying there undigested, means there should be a sensation of fullness, but naturally or normally. But here the patient, because maybe the hysteria already working in, the person will be having that empty sensation in the stomach, even though in the stomach they have something lying down which is hard to digest, they still have that empty sensation. So very strange and curious symptom, which indicate towards the hysterical nature that the patient is having. So Raphanus is one of the most flatulent of remedies. Wind accumulates so that it almost stops the breathing, because it is not going up nor going down. So as if it is getting incarcerated or collected in the chest abdomen area. So the patient is almost associated with difficulty in breathing. The most characteristic feature is the flatus cannot be passed either up or down, and such a condition occurring after abdominal operations has been relieved by Raphanus. You might be knowing in abdominal surgery, they use the gas to swell the abdomen. So after this surgery, mostly because of that gas accumulation, I don't know which gas they are using, nitrous, I don't know, I'm not sure about it. Anyway, post to that surgery, the patient usually will be having some um, the gas accumulation or abdominal distension. Mostly the patients will be complaining. So after two abdominal operations, if we have that symptom, the incarcerated flatus can be treated with Raphanus. Another remedy will be bismuth. Uh, then many symptoms, physical and mental, seem to rise from the uterus, culminating, and it is producing a pronounced attack of nymphomania. And even though when the patient is having nymphomania, she is having an aversion to her own sex and also to children, especially girls. So this could be asked as a MCQ, like a nymphomaniac drug, but with aversion to girls or aversion to her own sex. Then other mental symptoms are capricious nature, stupefaction, there is sadness or tears, everything indicating her hysterical nature, and at times alternating with hopefulness. You know what is the meaning of capriciousness?
When want something after give and then change mind, don't want again.
Mhm. Yeah, what we learn in Chamomilla and even in Sina, the children. So even another remedy coming up today, Rheum, it also has got symptom. Capricious. They want something, and when they get it, then they throw it off. That is capricious nature. And stupefaction, almost in a disease situation when they are not able to think properly or say anything. And they also have extreme anxiety with a feeling of impending death. So here in Clark, E.T. Blake, he mentions about 2 cases of sexual insomnia, which was cured with Raphanus. So he says that Raphanus is not just for female sexual sphere, but it also has got an influence on the male sexual sphere in an equal effect. So the first case is about a young man. He was suffering from reflex epilepsy. You know what we mean when we say reflex epilepsy? Or any condition when we say reflex followed by the condition name, what does it mean?
Is it similar to seizure triggered by some stimulation?
That is epilepsy, yeah. But I'm asking when we add the word reflex epilepsy, what it means. When we any symptom, when we use the word reflex before to that, reflex pain.
Is it similar to idea of allergy, like when it is triggered by certain specific sensory stimuli, then it will auto reflex as a seizure?
Mm, almost similar, but not exactly, because you brought here the treatment, and it's not treatment. It's mostly the causation we can say.
Oh, then.
But the same thing in a causation, like the problem may not be in that particular part. It is some other problem or some other organ is affected, and then we have having a reflex of symptoms. For example, here we are saying the patient is having epilepsy. So epilepsy, we naturally believe then there should be problem with his CNS that is related. But here the epilepsy, it is not related to CNS, it is coming from some other organ, some other problem, and that is having a reflex symptom on CNS. So basically the CNS is not per se affected. It is a symptom coming from some other part. Like when we say the reflex symptoms, especially the mental symptoms, which are reflex from uterine complaints, which mean the patient is as such is not having any mental complaint or the hysteria or whatever. That symptom we see in all the actia racemosa and the hysterical drugs. But because they have the uterine complaints, some mental symptoms are coming up. So, like that, here the patient was suffering from reflex epilepsy, and reflex epilepsy means epilepsy, it's not coming from the CNS, but due to some other reason. So, what was that? He had a surgery, adherent prepuce was removed. So, the problem was in his sexual organ, and adherent prepuce was the which was surgically removed. And after that, the healing was delayed after the surgery, and there was a furious priapism, and that caused a pain, a dragging pain at the suture, and this complaint in the sexual organ that resulted in the epilepsy. So reflex epilepsy or reflex followed by any other condition. When we use the term reflex, which indicates the problem, the symptom, whatever they say, we expect the reason to be of that primary organ. But when they use the term reflex, it doesn't mean the problem is in the primary organ concern, but some other location. Some other location is affected and its symptoms is reflected on some other organs. So here the patient, the epilepsy was not coming from a CNS per se affection. It was due to the surgery in the sexual organ, and that resulting in priapism. I don't know what made, because the sexual insomnia is cured with Raphanus. Maybe that was the single symptom that was considered for the treatment. So Raphanus 1x was given and it cured the case. Then the second case was in a woman of 40 with old pelvic troubles. Uh, she was given origanum and also platina, which origanum completely failed and platina helped only slightly. Raphanus cured. And both these remedies, or origanum and also platina, both are nymphomaniac remedies. So that might be the reason why the Blake had given origanum and also platina. But the relief or the complete cure was got in case of Raphanus. So these two cases indicate there is sexual insomnia, and the action on the sexual sphere of both males and females are equal. Not just the females, though we were saying that mostly in females, the sexual sphere, the hysterical, the uterine complaints, the nymphomania, and also the aversion to on sex. That was about the females, aversion to on sex and also to little girls. Though we concentrated mainly on the female, but in Clark it has been mentioned that the cases were cured also in case of males. So this also produced pain and stitches in the liver and spleen region, as like ranunculus bulbosus. There also we saw the both hypochondria is affected, and even here in Raphanus. It increases bile and salivary secretions. So when Raphanus is given, because the main problem is flatulence, and that will be the because of the indigestion. So if the bile and other secretions, digestive juices, its secretion is increasing, obviously the problems of indigestion should be reducing, and that will cure the flatulence. So when radish is taken or Raphanus is given, it increases the bile and salivary secretions, solving the problems of flatulence. There is globus symptoms and seborrhea or the increased production of sebum with a greasy skin. So other symptoms of seborrhea can be this one. Mainly here it has been mentioned the oily skin, but there can be itchy scalp, dandruff, flaky skin, hair loss, thickening of the stratum corneum. There can be sexual insomnia like calibrome, nymphomania, post-operative gas pains. And it is also good for pemphigus, which I told already when we are discussing the clinical condition. And pemphigus is actually an autoimmune condition. The skin, the mucous membrane, everywhere there will be blisters like eruptions. So it is not due to some burning. Usually blisters appear after to burning. But this is not burning, it's an autoimmune condition. So this blisters will be formed in skin mucous membrane. So Raphanus is a good remedy for pemphigus. So for the exam purpose, yeah, you can remember from body, but because we have already seen in Clark what are the important symptoms, now we can easily relate it over here. So in mind, they have the aversion to children, especially girls, and aversion to their own sex, edema of the lower eyelid. In the throat, there is that globus sensation, the hot ball, which is rising from the uterus to the throat and then stopping over there. In stomach, there is putrid irritations because of the incarcerated flatus. It is neither going up or down. So definitely there will be some kind of irritations which will be very offensive or putrid in nature. In abdomen, there is retching, vomiting, loss of appetite. There is tympanitic. Tympanitic means like in lycopodium, the air or the flatus has been accumulated, and that causes a very tender situation. Even the touch or the pressure will be very painful on the abdomen region. It will be distended and hard. No flatus emitted upward or downward. It can be associated with diarrhea, where the stool is liquid, frothy, profuse brown with a colicky pain. And that colicky we see here also the gripping pain around the navel region. And pad-like swelling of intestines, vomiting of fecal matter. So this condition, the vomiting of fecal matter, pad-like swelling of intestines can happen even in cases of some intestinal obstruction, some inflammatory conditions. So we have these symptoms of abdomen. And in female, there is nervous irritation of genitals. Menses is very profuse and long lasting, as we see in the clinical menorrhagia and metorrhagia. Nymphomania with aversion to her own sex and children, leading to sexual insomnia. So some drug relations has been given, like it is antidoted by copious cold water, milk and water aggravates the pain in abdomen. In comparison, in flatulence, we can compare with carbovich and also with lycopodium. Masturbation in females due to nymphomania, glacial is one remedy and origanum is another. Even platina is another one. Swallowing resulting with a pain in back, Rustox is the globus hystericus nature. You can see in Ignatia and Nasophytida. Aggravation by Slighter's jar, seen in bell and nitric acid. Belladonna, because of that inflammatory condition. Even in belladonna, we can see that there is a statement given in Allen's keynote, the intestine, the pad-like intestine. Because of that inflammatory condition, we can see the intestines being inflamed, reddish, lying like a pad. So that indicates that acute inflammatory condition. So that aggravation by jar, we can compare with bell and nitric acid. 3 to 4 a.m. aggravation, which is also seen in Calicup, Calibite, Thuja, and Medorinum. Uterine affections to sepia and thalaspi bursa pastoris. toothache in pregnancy, Ratanhia, macaque, and sexual insomnia to calibro. We go to the third remedy, that is Ratanhia. Do you remember anything about Ratanhia?
The rectum remedy is very good for burning hemorrhoid, bizu in the anus.
Yes. Hemorrhoids is one of the most important symptoms. So almost the
Every time I look
hemorrhoid.
at Ratanhia, I think every time I look at Ratanhia, I think of anus.
Which one? Which one? Ratanhia?
Yeah, this one, the anus bizu also.
Anal fissure, that is another important symptom of Ratanhia. The conditions in which there is anal fissure mainly, that is Ratanhia. Ratanhia, its common name is Chlamydia triandra, can be asked as an MCQ. Its common name is Ratani, then Mapato, Peruvian Ratani, not that much important. This one, Mapato, Chlamydia triandra, could be asked. Belonging to the family Polygalaceae. Traditionally, Ratanhia is drunk gargled or applied topically as a tincture or syrup to shrink tissues. People may drink the tincture in order to constrict tissues to restrict the flow of blood or secretion or the mucus secretions. Homeopathic preparation, the tincture of the root was used. So the clinical conditions, as you told, for the fissures, anal fissure, there can be constipation or dysentery, but mostly it would be constipation, the complaints of hemorrhoids. It's also indicated for worms, pinworms especially, and in eyes there can be pterygium, where there is an abnormal growth of conjunctiva onto the cornea. So these are the clinical conditions. So once again, this drug is there in Ellen's. So for your exam purpose, this will do. So this is a good remedy for toothache during early months of pregnancy. The earlier medicine that we did, the Raphanus, it was also having toothache during pregnancy. And another remedy will be this one, Ratanhia. The tooth feels so elongated, and the patient, she is having aggravation from lying, and it compels to rise and walk about. Just imagine she's having terrible toothache, especially during the early months of pregnancy. She's not able to lie down, she has to walk about. And because this is a hemorrhoid complaint, so GIT complaints will be there. There will be constipation. Stool will be very hard with much straining. And because of that straining, it results in the protrusion of hemorrhoid. And that results in long lasting aching and burning pain in the anus. And the important remedy for that symptom, for hours after stool, the pain will remain, the burning pain remaining. Another remedy is sulfur. And yet another remedy is nitric acid. So after stool, the pain, the burning pain, if it is remaining, sulfur and nitric acid is the medicine. Pain after stool, as if splinters of glass were sticking in anus and rectum. Splinters of glass, the comparison will be to Toja. If it was another medicine with this splinter sensation, not of glass, but splinter-like sensation, another one will be nitric acid. And then there is a sensation after to stool or hemorrhoids, as if sticks remain. Sticks. You know, if it is sticks, what will be the remedy? Stick, knife.
Nitric acid? What?
Yes, that is mostly that I told earlier. The splinters, nitric acid is mostly that splinter sensation. They have that general feature, not just in GIT or the rectum. Nitric acid is having that splinter-like sensation throughout the body. But there is another one, a stick-like sensation. Some sticks has been remaining after two hemorrhoids. Aesculus. Aesculus is that a stick-like sensation. Then there can be fissures of anus with great sensitiveness of rectum. And then we go for nitric acid. Even nitric acid is also having fissures. Nitric acid, have you learned that nitric acid?
Yes.
Yeah. So even in nitric acid, you see this splinter-like sensation, and
Yeah, and very
after the
sharp
first,
sticking pain. The
Excuse me?
sharp sticking pain. Sharp
Yeah,
splinter-like pain.
sharp splinter-like sensation will be there, and even they have got fissures, especially in the area where the skin and the mucous membrane is joining. So even that is a good remedy for anal fissures, nitric acid. And there will be burning pain even after the stool is passed. There will be burning pain in case of nitric acid. So when we have all these similarities, how can we differentiate both the remedies, Ratanhia and nitric acid?
Can we differentiate from mental emotional symptoms?
So what will be the mental symptoms?
This nitric acid have very great anxiety of health,
Hmm.
but then they also hold a grudge.
Hmm.
I would say it will not be moved by apologies.
Mm-hmm.
Yeah, I have seen a case like that, cursing, nihilistic.
Oh, and did you give nitric
Yeah.
acid?
Yes, the nitric acid I give because of the he is the CKD patient
Uh-huh.
and he has very serious mouth ulcer. At first, I started thinking of mercurius and all that, but after that, when he talked to me, the way he cursed, the grudge, and after I check, it is just like. And I asked him whether how is your throat, and then he mentioned as like a stick, very sharp, stunning, and poking him, very
Mm-hmm.
pain. So I give nitric acid,
Okay.
and it works. Yeah.
Wow. Okay. Yeah. So the mild symptoms is the main thing. How to differentiate Ratanhia and also nitric acid. As Lenny told, the person will be very headstrong, very vindictive in nature or grudgeful. They will be keeping that revenge uh, in their mind for a very long time, and they want to finish off that revenge. They won't be forgiving. Even you apologize, the person won't be forgiving. They will be very revengeful in their mind. So that is the feature. From that mind symptoms, we can differentiate. And as Lenny told, there is a morbid fear about diseases. In the textbooks, it says mainly cholera, but nowadays it is not just specific to cholera. Anxiety about their health, any disease can be there. And then another feature, when we come to it, the physical symptom. In this one, in Britannia, though we told there is dysentery, but mostly here it is the constipation that is characteristic. But in case of nitric acid, it is the loose stool or the diarrhea which is more characteristic. It is rarely indicated if the patient is having constipation. So in case of when we come purely to the physical symptom of this GIT, though both the drugs are having hemorrhoids, that fissures. In case of Ratanhia, it will be the constipation or the heart stool, and straining for that heart stool will release or it will uh, result in the prolapse of the hemorrhoids. But in case of nitric acid, this is possible even with a soft stool or a direct stool, no need of any constipation. So that is another difference between Ratanhia and nitric acid. So then another remedy we can compare over here will be aloes. Aloes is also having hemorrhoids. They don't have that much characteristic fissures, but hemorrhoids is so. Um, so can anyone differentiate how will be aloes hemorrhoids and also Ratanhia hemorrhoids? How can we differentiate that?
The branch of grapes for aloe.
Yeah, for aloe it will be bluish like a bunch of grapes. And actually,
Yeah.
both the drugs, Aloes and also this one, they are having amelioration from cold water. Both are having amelioration from cold water. But one of the difference, yes, one difference is that it will be like a bunch of grapes, aloes, it will be bleeding, and because it is a venous bleeding that is in hemorrhoids, it will be appearing bluish in color. It's not like they say a bunch of grapes and bluish appearance. Don't think it will be too bluish. It is because of that venous bleeding that is happening. So it will be deoxygenated, and hence that bluish color, slight tint of bluish color will be coming in the aloes. And both are having aggravation from cold water. But one major difference between the Ratanhia and aloes hemorrhoids will be, in case of aloes, there will be pain, a colicky pain before and during the stool passage. Even if it is diarrhea, because there is a sensation, the patient has to rush to the, in case of aloe, the patient has to rush to the toilet because he is not confident about his sphincter ani. Flatus and even stool may pass off. That's the condition in case of aloes. But however, that pain, that intense gripping pain he feels, it is felt in case of aloe during and also before to the passage of stool, before and during. Once the stool has passed, there will be much relief. There won't be any pain in case of aloes. But in case of Ratanhia, even after the passage of the stool, we see that it is followed by long lasting burning and aching pain. Pain after stool as if splinters of glass. So even after the stool has been passed, in case of aloes, there is complete amelioration of pain, and the patient may go into a tired sensation, a tired condition with copious sweating. That is aloes. But in case of Ratanhia, symptoms being much similar, but here there will be pain even after stool passage. And these fissures we can see in the nipples of nursing women as like graphitis and also sepia. So in Ratanhia, though the mental symptoms have been given, doesn't matter much for the exam purpose. But still, they have a compulsive neurosis or OCD. There can be superstition and compulsions, especially of religious nature. They are very much concerned about the rectal hygiene and critically they have the problems with the rectum itself. It acts on rectum, eyes, and also teeth. There is hemorrhoids, which is protruding after stool. There will be fissures of anus. The most important feature is excruciating burning and long-lasting pain in the rectum after stool. As if splinters or glass were in rectum, similar to Aeschylus and nitric acid. Here, Aeschylus was also considered because of that splinter or glass-like sensation. But in some of the authors, I don't remember which one, Clark or something that is following, the Aeschylus is given in separate bracket, indicating they are having a stick-like sensation. But we really, I mean, if we have to people who are native English speakers, they may be correctly differentiating it as a spindle-like sensation, a stick-like sensation. They may be, but otherwise, who are not native speakers, I don't know how much they can differentiate. They may be just saying something stick-like or a knife-like or a spindle-like. So we could put both together in the comparison. But as I told in some of the slide that is coming, it is shown separately. This has caused a great sensitivity and anal fissures, better with warm applications. I don't know. It is cold application actually. I don't know which book is this. Maybe I don't know. Better leave it. Important concomitant. This is important. Important concomitant is bursting headache during straining during stool. Pain in the middle of the forehead as if brain would fall out. So this symptom is also coming up in case of aloes actually. But in aloes, that bursting headache is not during the stool. Because after to this, especially when in case of aloes, when they are constipated, they will be having that headache that falls, not falls, They will be having a anger, mood, etc. But that is not a concomitant. The headache is not a concomitant during the stool passage process in case of allos. But in Ratanhia, it is a concomitant, important concomitant. Even in provers, they have got these symptoms. So specific for pinworms, toothache in pregnant women who have to get out of bed at night, like Mecca. They are having complaint, were lying down, so they have to move out of the bed. Modality is aggravation at night from touch, exertion. When you go to boric, the rectal symptoms are more prominent and it has got the clinical confirmation. It has cured pterygium. There will be violent hiccup as like that of ranunculus. Cracked nipples and also pinworm complaint. Head, the bursting in head, that is one of the important concomitant during and after stool. And in stomach, there is pain like knife cutting the stomach. In rectum, aching pain as if full of broken glass. That burning pain will be the remaining even 4 hours after stool, similar to sulfur and nitric acid. Stool must be forced with great effort that result in the protrusion of hemorrhoids. There is fissures of anus with great constriction, burning like fire, and that is temporarily relieved by cold water. So this is what I told you, relieved by cold water, stick on with that, not the other one. Then there can be, because it is hemorrhoids, there will be some oozing that is happening at the anal region. Can be given as a specific for pinworms. And other remedies will be santonin, tucrium, and spigelia with itching of anus. So in J.H. Clark, Cushing, who made a proving of Ratanhia, says it caused great itching in the rectum, and he has cured with it, with Ratanhia, nearly every case of pinworms in his practice. In a woman who is very old and feeble, he cured with Ratanhia 3x internally and Ratanhia rectal suppository each night. There was frequent discharges of mucus, blood, and pus from the bowels night and day with great pain, and it almost prevented her sleep. So he gave 3x internally and also as an external suppository, and she was cured. Cushing also considered that next to Sanctionaria nitricum, Ratanhia meets more rectal cases than any other remedy. Rummel relates the case of a servant girl who had rapid twitching of the lids of right eye to such an extent as to hinder her seeing. There seemed to be also a rotatory motion of the ball, and belladonna and calcarea failed to relieve. Ratanhia 12 relieved quickly. Now, this case, I actually felt so cure or very strange to believe. I didn't get exact indication also why that medicine was prescribed. It see that it can cure a pterygium, but over here it is not mentioned whether she is having any pterygium. Just told rapid twitching is the right eye, hindering the vision, and also a rotatory motion. And Bell and Calcarea failed, then why it was indicated the Ratanhia? It was not given. Anyway, he had cured the condition. Just to say, there is perhaps no plant the properties of which have been so well indicated by chance as this. By chance, this was discovered, and for him, this medicine was mostly indicated, or it arrests the passive hemorrhages, epistaxis, hemoptysis, metorrhagia, menorrhagia, etc. Because it was acting as a constrictor. People used it as a constrictor. We saw earlier when we were describing its features, we saw that people use this Ratanhia to constrict the blood vessels so that it can arrest the hemorrhages. So this is also indicated in hemorrhages, hemoptysis, metorrhagia, and also successfully used against scurvy, mucus discharges that is coming out from bronchus, vagina, large intestine, because of their constricting nature, and also useful for incontinence of urine, chronic edema, etc. Dr. Turner, who no doubt did not suspect that Ratanhia produced abortion, had the happy idea of prescribing it as a tonic in cases of incipient miscarriage, and thus preventing that accident in delicate and nervous female who had never yet been able to go to their full time. However, I don't think much because when we go towards the specific symptoms, homeopathically, Ratanhia is usually not given for. I mean, I'm not seen. We have better remedies for this hemorrhagic conditions. Maybe that or they may or these symptoms may be old school medication also when before the homeopathic prescription they were using these medicines for these complaints. So in case of Tessier, he was using it for the hemorrhagic conditions, but in Tornell by Dr. Tornell, he believed that this medicine can prevent miscarriages, abortions. So in females who are very delicate and nervous with a tendency of incipient or a threatened abortion. He prescribed this as a tonic, Ratanhia as a tonic, and they were able to conceive the baby or go to their full time, who were not able to do so before. Then another case is a lady who suffered from constipation and fissure of rectum, very clearly indicating, and caused her horrible pains and damaged her health. Retinol, he ordered daily injection mixed with 1/4 of Ratanhia, and in a very short time, constipation and fissure were cured. A typical case of Ratanhia. And the provings of Hartlov and Trinks chiefly, it brought about the keynotes of Ratanhia. That is, during straining, the stool was so hard. We already saw that it is constipation. She cried out, and that resulted in the protrusion of the hemorrhoid, which followed by a long time burning pain in anus. The burning persisted for a long time after stool is very characteristic of Ratanhia, and it occurs when the stool is direct or as well as when it is hard. Burning also precedes and accompanies. So it is not just after the stool we see that, we get that burning pain before stool and during stool. In case of aloes, this pain, that gripping colicky pain will be, it is not burning in case of aloes, but that pain will be relieved after stool. But in case of Ratanhia, it is not relieving. It is the before, during, and after. And another peculiarity is the bursting headache, which we already discussed. The drug relation follows well sulfur, bovista, and sepia. Comparison for fissure of anus nitric acid. For the anal symptoms, the hemorrhoids like sulfur, iris versicolor, cantharis, peonia, and graphitis. Graphitis is nearest because even graphitis can cause that fissure symptoms, but it has not got the constriction of Ratanhia. There is a splinter-like sensation, or if it is a glass in rectum, tuja, and I told you, if it is sticks, they kept it separately, aesculus hypocastanum. Pain in head from straining at stool, we have indium, pulsatilla, and silesia. Toothache of pregnancy, raphanus, magnesium carb, and chamomilla. Something alive sensation, crocus sativus, and also tuja. The next remedy, Rauwolfia. There is no much to say. You know it for the high BP. So it is the Indian snake root, devil pepper, or serpentine wood belonging to the family Apocynaceae. Have anyone of you given Rauwolfia serpentina? There is no need to ask. Still I'm asking. Rauwolfia
No,
for BP?
no.
You never gave. Yeah, it is. I'm feeling so surprised, but it is like a one-shot remedy. You can say, of course, not in a curative manner, but like a one-shot remedy when the BP has gone too high. For a short term, maybe we could give Rauwolfia, but its effect is similar to like that of any hypertensive remedy, the allopathic hypertensive remedy if the patient is taking. It is equal. We can just say what we were taught in my college was if you say a BP patient, you take a hypertensive medicine, And then if you are giving Rauwolfia, both are hand and same to same. Like it can be causing after effects in the patient in the same manner. So not much to be prescribed Rauwolfia. We should be always very careful. But yeah, it's a specific for high BP. So it contains chemicals that have been shown to cause lower blood pressure. Other possible side effects may be nasal congestion, change in appetite and weight, nightmare, drowsiness, and loose stool. So Rauwolfia serpentina, it is given for high BP, irritative condition of central nervous system. There can be even level of insanity, violent maniacal symptoms, and fever during pubertal stage. I think in case of Boric also, yeah, some changes are there. Mainly for BP, that's the main symptom, but there can be some maniacal symptom or insanity and fever during puberty. So pubertal fever, if it is associated with high BP and some maniacal symptoms, we can think about Rauwolfia. There should be high BP. And this was given in British Homeopathic Journal by Dr. Templeton. And this is like a passage in which he is asking, is proving really necessary or are they worthwhile? And the explanation why how he says it is important, that is given under Rauwolfia serpentina. So he says that preparation of these roots of Rauwolfia belonging to the Persanaceae family that found to have definitive hypotensive effects, especially when tried on animals, in addition to hypnotic and sedative effects. So this medicine, Rauwolfia, it is having some sedative effect also. The patient will go into a sedative condition. Maybe the BP is being reduced. So similar to passiflora, this also can induce a sleepiness in the patient. The effect in lowering blood pressure is probably the medicine is causing a depression of the BP regulating centers in the hypothalamus. That's what he is explaining. It was interesting to note that the patients with angina of effort were not relieved, but those with precordial discomfort occurring at rest were ameliorated, along with palpitations, vertigo, and tinnitus. So here, because it is a BP remedy, definitely CVS or the heart should be in problem. So in case of angina during any exertion that is not relieved by Rauwolfia, but angina during rest, angina is possible even during rest. So even that angina can be ameliorated using Rauwolfia. For the exam purpose, Rauwolfia, I don't think it will be asked because it's only few sentences to be told. So for the exam purpose, only this slide will do because the further slides, it's mainly coming from Clark or some other book, which have given so many symptoms in detail. Exam purpose, it won't be that important. For exam, yeah, it's only this much, the high BP, the insanity, violent maniacal symptom, fever during purpurium, and irritative condition of central nervous system. But the most important sentence over here will be is indicated in high blood pressure without erythematous changes in the vessel. So high BP is there. So now when we discussed about the angina, we even saw the angina at rest, not the angina during exertion. That's not indicated in Rauwolfia. So even in Rauwolfia, the mostly the functional BP, not the organic lesion, not when the erythematous plaque have been formed. But before to that, due to some functional reasons or the nervous reasons, if the BP is arising, then we can think about Rauwolfia. And when we learn this sentence, high blood pressure without marked erythematous changes, do you remember the remedy which is indicated when there is BP with erythematous changes? It is also another tincture if there is adenomatous plaque present. Now, can you say? And the remedy for high BP, another tincture. No one making a guess also?
Calcareka?
It is a tincture. It is usually given, like for Rauwolfia, it is given as a tincture.
Crataegus.
That's how you differentiate both the remedies. In case you are not able to find out the constitution of that patient and the patient is having high BP, Rauwolfia is always to be thought of. But one way to differentiate, because one way to differentiate crataegus, which is also for BP, will be the presence and absence of adenomatous. If there is no adenoma present, but only functional high BP, then Rauwolfia. But the organic lesion is there, which means there is a adenomatous deposition, then crataegus is the remedy. So that's a method of differentiating. And of course, it is acting as a sedative. So for exam purpose, this much will do. But so many symptoms, so many symptoms. For the exam, it doesn't matter. Okay, it doesn't matter for exam, but we'll go through it. In mind, there is weariness, and the patient is feeling better during violent exercise. There is irritability and depression, which is ameliorated when the patient is in alone. He is can't be bothered. Everything is an effort. Dazed, daydreaming. Things seems to be unreal, out of world, detached. Maybe showing that the maniacal tendency, the irritate. We saw that the CNS is affected. So those symptoms are coming out when the person is totally daydreaming and out of in a dazed condition, and also detached out of the world. Is rude, abrupt, make mistake in spelling, forgetful for what has done, is tired, lack of interest, and also dry and totally unsociable. That is why everything is even feeling better when he is alone. And in head, because it is the CVS that is involved, high BP. So like glonoin, there will be a sensation as if the head would burst. Like cannabis indica, the head would float off. There is a constriction sensation in the scalp, and that is better by cold application of fresh air. And during sleep, like cocaine, the patient will be having some crawling sensation, like a worm is crawling through the skin on the scalp. That is what the sensation will be about. But I still repeat, not for exam, you have to remember these symptoms. In the heart, there will be palpitation or a loud, forcible beats, especially on climbing stairs or on sudden exertion. There will be a constricting sensation in the apex beat region, sharp stitching pain coming and going suddenly, similar to calibi. And that is usually seen when the patient is hurrying with a sensation of suffocation, especially going upstairs. And because there is BP, there will be even pulsations that can be seen in occiput and also temples, extending from hypogastrium to the heart. So whatever you can remember from this in case, just in case. But I would say just remember this palpitation that is happening, especially on climbing upstairs. Because of the same constriction sensation which is felt in the apex beat, it is also seen on going upstairs. And that pain will be like that of calibi coming and going suddenly, like a sharp stitching pain. That much will do. And then there can be sharp pains, right-sided, extending to jaw and right arm. So usually when there is an angina, we will be having the pain radiating to left side, but here those pains will be radiating towards the right side, to the jaw and also to the right arm. And in sleep, because we told it is a sedative, the person will be sleepy, he could sleep like eternally. And sometimes he may be dreaming about traveling, of being killed, of drowning. Even if you want to study only those colored ones for exam purposes. For example. Then for relationship, comparison with Lycopodium, Lilium tigrinum, Natramure, Helleborus, Lactasis, and Lonois. The next remedy for today is Rheum. Do you remember anything about Rheum?
This is in the strawberry jam, the Saint Alphonse strawberry jam. They got mixed the room, rhubarb. I'm not sure about the remedy, the symptom.
You were saying from it is taken from the rhubarb.
Yeah, because we have a jam that is mixed rhubarb and strawberry.
Okay. Okay. So it is actually given exclusively, I can say, as a child remedy, like that of chamomilla, cinna, Rheum will be. So usually the question asked in case of Rheum will be explain a Rheum baby. So for the children and mostly the dentition related complaints. The characteristic feature of this Rheum baby, they will be having some symptoms similar to that of the chamomilla and also cinna, something similar to calcarea, carb, and silesia. But one important feature of Rheum will be the sour smelling. Because the baby will be having intolerance to acid and indigestion will be the whole body will be having a sour smell. And it is told that even after washing or taking or giving birth to the baby, that sour smell will not be leaving the baby. It's like in case of macabre, then that sour smelling we can see in sulfuric acid. Yeah, so that sour smelling body or sour smelling child is the most important feature of Rheum. So it is Rheum officinale, Rheum palmatum, or rhubarb, as like we not told. Though called as Turkey from China, the exact species yielding it not being certainly known. And I don't know how they are making Rheum. Anyways, the common name is Chinese rhubarb and belonging to the family Polygonaceae. It is in the old school or the pharmacological activities given as a cathartic, anti-inflammatory, and antioxidative. It is well known to promote excretion and decrease the reabsorption of bilirubin. So it has been widely used alone or in combination for the treatment of cholestatic hepatitis from ancient times in China. But these symptoms we have not, this hepatitic symptom we have not got in homeopathy or not much important also. The homeopathic preparation is from the tincture and trituration of the dried root. Possession is by eating prunes or any unripe fruit. During dentition, can be complaints of spasms and dislocations. It is suitable for children, especially during dentition. The sour smell is very characteristic. The child smells sour even after washing or bathing. Even Hepar is also having that symptom. Screaming of children with urging and also sour stool. So they will be having that tendency to pass stool. They will be having a urging, but it is very difficult. So they will be screaming during that process. And when the stool is passed, even that the whole baby is having sour smell. The discharge will be sour, and even the stool will be smelling sour. Even they will be sweating a lot around the head region, like in calcarea curve and silicea. But that head sweat may or may not be sour. Only that is saying that it can be sour, it may not be sour also. Child will be crying and tossing about all night like sorinum. The opposite will be lycopodium. The lycopodium child. Another remedy like sorinum who is crying and tossing all about night is, you remember that remedy? Like sorinum, another one.
Always crying.
Crying all night.
Ratanhia.
No, I wrote J. It is a medicine starting with
Easy.
J.
Okay.
Ah, very difficult because we don't learn that. It's only in comparison when lycopodium you study from Allen's not in comparison it comes. So at night the child is completely crying, tossing about, not allowing even the mother or the caretaker to sleep. That is Sorinum jalapa and Rheum. And it's reverse. Like the child will be problematic in the daytime, but will be peacefully sleeping in the night. That will be lycopodium. And the capricious nature, that the child is impatient, desiring many things, crying, dislikes even favorite playthings, that which we learn in Chamomilla Sina, we can see in case of Rheum also. There can be sweat of scalp, constant, profuse, whether asleep or awake, quiet or in motion, the hair is always wet. It may or may not be sour, like calcarea, sanicula, even silicea. But in calcarea, it's usually when the baby is going to sleep. But this one, Rheum, is always, whether he is sitting quiet or is moving about, or he is asleep or awake, he will be sweating almost around the head region. Hair is always wet, and that may or may not be sour smell. There is difficult dentition. Child is restless, irritable, peevish, with pale face and sour smell. So that sour smell is the characteristic feature of Rheum. They desire for various kind of food, but cannot eat them. Easily become repugnant, or they don't want to eat it. There is a colicky pain, and yet another symptom is this colicky pain. And that colicky pain is aggravated, or it comes about when he is uncovering an arm or leg. So just imagine when the baby is being uncovered, even while sleeping, the one arm or leg is getting exposed, then the patient or the baby will be having this colicky pain. This colicky pain we can see with every sour stool, but this is not ameliorated after stool also. That colicky pain still remains even after stool. This is the clinical symptoms of Rheum baby. All the symptoms much similar to that of Chamomilla and Senna, the difference being the sour smelling, which is not moved even after bathing. And then another important symptom, the head sweat, how it is differentiating from calcarea, because sleep or awake, quiet or restless, they will be always sweating, and that sweat may or may not be sour, because all the other discharges coming from their body, even the stool, that smells sour. Then another important feature you shouldn't forget is colicky pain, especially from the exposure of even one arm or even leg, and that is not ameliorated by stool. Rest are symptoms usually you see in any drug when the child is irritable during dentition. So sour odor of perspiration and discharges mainly in children and infants with diarrhea and also during dentition. The key symptoms. There is restlessness with desire to weep. The child is demanding impatiently for many things, cries and dislikes even its favorite playthings. There is screaming, with urging of stool and sour stool, state as if half asleep, unable to collect his thoughts for long after waking. Doesn't matter even if you fall. Physical symptoms, sour odor of perspiration and discharges. There is excessive perspiration from even slight motion. They're easily tired. Worse at night, we saw that the patient will be crying and tossing about in the night. There is shivering with stool and tendency to frown. Difficult dentition, colicky pain, which is not ameliorated even after passing stool, and also diarrhea during dentition. The colicky pain will be ameliorated by doubling up, like in colocynth. There is good appetite, but the patient, or there is a desire to eat many food, but the patient soon become repulsive. Fullness as if eating too much. Desire for stool after a meal. Aggravation, uncovering, eating, or moving about. The Hahnemann proving of Rheum has confirmed many of its traditional uses in the form of compound rhubarb powder along with magnesia and ginger. Most of us remember it as one of the terrors of the nursery. Nursery means during the nursing period, lactation, both the mother and also the baby at that stage. So it is a great remedy for suckling, the infant who are suckling or breastfeeding, and children, especially during dentition, as well as to pregnant and nursing women. It is particularly suited. And this symptom actually we don't learn this in Allen's keynote. So exam wise, this is not important, but I saw this in Clark. So this says that this medicine is very good. Rheum is very good when the blood serum it becomes yellow in color, very much deep yellow in color. Otherwise, it is having a chalky appearance. But if it is becoming blood yellow color and the urine is blood red color, we can think about it. So this condition, when it says the serum becoming deep yellow or the urine becoming blood red color in hematuria, mostly indicating condition of stone, nephrolithiasis. I have never seen Rheum being prescribed for a nephrolithia condition, but in Clark it is given the Rheum. It contains large amount of chrysophanic acid, and it is named so because of its brilliant yellow crystals. And among its many other constituents, it is oxalate of lime or calcarea oxalate and also rheotannic acid. So that indicates this is a good remedy for stone complaints, nephrolithiasis conditions, especially if it is oxalate. Oxalate, then it is very good. So maybe that's why it is called that this medicine can make the serum, blood serum yellowish and also the urine blood tinted or hematuria. So indicating its importance in nephrolithiasis. Though I have never given Rheum for nephrolithiasis. The grand keynote of Rheum is its sourness. The stools are sour, the taste is sour, the whole body has got a sour smell. No amount of washing will wash the sourness out of the characteristic Rheum baby. So other symptoms we had told it is in sucklings during dentition, the night screaming, and that always sopping wet hair. The Rheum child is as acid in temper as he in his body, like very furious in nature, peevish, impatient, dislikes even his favorite playthings. So with a few drops of Rheum tincture, I have relieved severe constipation. I maybe Clark, I don't know. I'll have to refer. Few drops of Rheum tincture, it have relieved severe constipation in an acid child who was intolerant to almost all remedies in the attenuations. But Rheum is not exclusively a children remedy. Its symptoms are good for any period of life. At Another important symptom of peculiar symptom of Rheum, which is not mentioned anywhere, is the bladder is weak, must press hard to urinate. Like the symptom we see in Barita cup and Macmore also, I think. Macmore, Macmore is having such a symptom, over. To pass urine, also to pass stool, they have to press their abdomen. Something Macmore is having. Anyone remember? Macmore is having the same symptom. They have to press down the abdominal muscles to pass urine. So Macmore is also having that symptom. Macmore is also good during the difficult dentition, unable to digest milk. For the modalities, aggravation at night, uncovering. We saw that even one arm or leg, if it is getting uncovered, there will be colic. From cold exposure, motion, walking, standing, after eating plums, before, during, and after stew. Everything is an aggravation for them. Amelioration will be from wrapping up, like silesia, from warmth, lying doubled up, the colicky pain, like colocin, and it takes up the purest positions in order to rest or to sleep. In any shape, position, they will be trying to sleep. Complementary after to make up when milk disagrees and child has a sour odor is antidoted by camphor, chamomilla, colocin, myrrh, nux and pulse, antidote to cantharis and mecca. Just remember the mecca because even mecca is given for the difficult dentition. May be given after abuse of magnesia if stools are sour. Compatible with epicac. The last drug for today is rhododendron. And you know what for rhododendron is given?
The thunderstorm.
Yeah, aggravation from thunderstorm. Similar, almost similar symptoms with rustox. The wet stormy weather, the rheumatism, much similar. Someone else was going to talk. Who was that? All right. Thank you. So the botanical name is chrysanthemum or rhododendron chrysanthemum. Common name is yellow snow rose. This can be asked as a MCQ because you don't get any clue from that. The family Ericaceae. It is much used in Siberia as a remedy for rheumatism. Homeopathic preparation, tincture of fresh leaves has been taken. So causation is stormy weather or the thunder. You know, other remedies which are having problem from thunderstorm weather.
Phosphorus.
Yeah, phosphorus. Any other remedy? There is one remedy that which we learned recently with under duration. Anyone remember? When I forgot. Phosphorus. Let I search. Because when I was preparing, I didn't reach up to this one, rhododendron. That's why I couldn't refer. Thunderstorm, yeah, sodium. The last class we were discussing about sodium. So for the sprains, eating fruit, getting wet, or catching cold. like that of Restrox. So much similar to Restrox in its symptoms. Simply given for rheumatism, stiff neck, for cervical spondylosis conditions, for lumbago or lower backache. In case of Allen's, mostly the rheumatic complaints, so it is indicated in nervous person who are dread of storm and are particularly afraid of thunder. Aggravation from the storm when we have remedies, phosphorus, sorinum, natron carb, and silesia. This is important for MCQ. Okay? They cannot get asleep or remain asleep unless legs are crossed. This usually asks for MCQ. They cannot get sleep unless the legs are crossed. There is toothache. Every spring and fall during sharp east winds, worse from change of weather, thunderstorm, windy weather. And yet another important symptom is the orchitis or after to gonorrhea, after effect, there can be induration and swelling of the testicles. So similar to clematis, this medicine rhododendron is very important. There is a sensation as if it were being crushed. So this can be asked because whenever we learn rhododendron, we learn it actually as a rheumatic remedy. And we remember only the rheumatism. We tend to forget about its action in the male sexual system. And the male sexual system, only one sentence is the this is the only sentence that is present that like after to gonorrhea, there is induration and swelling of the testicles and orchitis sensation as if the testicles have been crushed. The only sensation in the male sexual system, but usually asks for exam. Mostly 4-5 mark questions in my college. Okay, I mean when I was studying for BHMS. So if we don't know this single symptom, we are going to get affected. Whatever we do, whatever we write, okay, we write other symptoms that of storms, maybe we get 1 mark, but until this single sentence is written, we don't get good marks about 3 or something. If that is needed, the single symptom is very much important, and that also shows this is an antipsychotic remedy. That's the importance. Antipsychotic remedy and the rheumatism followed after to the gonorrheal affections. Now, regarding the rheumatic complaints, there can be acute inflammatory pain or swelling of joints, wandering from one joint to another. It is severe at night, especially the stormy wet weather or when there is a thunderstorm. The drawing teary pain will be seen in the limbs, which is worst at rest and also in wet, cold, windy weather, similar to that of Restrox. So usually Restrox and rhododendron is asked for a comparison for their rheumatic complaints. Can also be given for gout with fibrous deposit in the great toe joint, and often it is mistaken for bunion. The gout, other remedies is ledum and also colchicum. Complaints are aggravated in stormy wind weather. So the complaints are actually this much only. They're having a dread for the storm. This one, wet weather is a problem. And then the acute inflammatory joints, and the rheumatic drawing, tearing pains. So this will be the symptoms. Can you differentiate Restrox and this remedy for the rheumatic complaints? What will be the symptoms similar and what will be the symptoms dissimilar?
Last talks beginning to move is most painful.
Hmm. But even here it is same given.
Same.
Was at rest, an aggravation, wet, cold, event. Yeah, so that becomes the similarity. Yes. And the dissimilarity,
When they first move, pain until they continue
the
moving, right?
continued movement, yes, okay. Like that we
Is
can go. Yes. Then
that's not here in Rhodo. Then when
rhododendron, we just say the rest is aggravation actually.
okay, okay.
Movement is simulation, but not exactly like continued motion. Uh, not saying like in Rustox. The continued motion is amelioration. That is not specifically said in rhododendron. Yeah, so that is a difference. Any other thing? Any other difference? See this one, thread of storm, the thunder. We don't have it in Rustox. Both are having complaints from wet weather, yes, but this dread of storm, we don't get it in Rustox. That's another difference. And in Rustox, another difference will be the pain. We say here they are saying the pain that is wandering from one joint to another, rheumatic drawing, tearing type of pain. But in Rustox, it clearly mentioned as if it is being scraped, like with a knife, that part and the tendon has been torn off from the bones. That particular sensation is told in Restox, but not in case of rhododendron. And then the specific features of rhododendron will be this one. They cannot get asleep or they remain asleep unless legs are crossed. This is a very specific symptom for them. Unless the legs are crossed, they can't sleep. I had a friend. I had a friend. She didn't have any rheumatic complaints, but out of habit, unless she keeps her legs crossed, she can't go to sleep. Uh, and then another feature will be this: the induration and swelling of the testicles after gonorrhea. That will be the specific feature of Restrox. Even sorry, in rhododendron, even in Restrox, there is gonorrheal affections. There is some symptoms related to the orchitis, but that is more characteristic of rhododendron. So that's how you differentiate. And this gout with fibrous deposit. Restrox is not specific for gouty deposits, but rhododendron is. Aggravation, we already told. The storm with windy weather, electrical changes, approach of thunderstorm, and better from wrapping the head warmly, like silesia, dry heat, and exercise. Now, these symptoms, I leave it to you. I don't want much of you to study the symptoms. The faintness, confusion, excitement before storm, they're forgetful of words while speaking, omitting words when writing. Forget it off, don't bother. Only remember this sentences given in bold. Aggravation at rest, amelioration motion with pain in heats. Orchitis, epididymitis. Pain in testicle, facial pain, amelioration moving the lower jaw. Then sleep on back. The sleepless, this is very important for them. This characteristic position, even for MCQ, it is important. Aggravation from storm, during storm, and amelioration from motion. Now, these symptoms in Clark, actually, I didn't get time to read until here. So I will read with you, along with you, what is this Clark saying. So the golden flowered rhododendron is not much known in general medicine, but the treasury of botany says that it is a narcotic. So it has got good action in relieving pain and to induce drowsiness, stupor, or insensibility. Uh, its provings by Cedil Valle and others, it shows that it produces sensitiveness to storms and also weather changes. And that is the grand keynote of this remedy. And it disturbs all parts of the economy or the body, producing delirium, fever, headache, neuralgia, almost similar to Restrox, because in Restrox also there is fever, delirium, etc. And in the fever, in case of Restrox, they dream about doing some hard work or exercise like rowing, boat, etc. In case of Restrox during the fever stage. And inflammations, but the chief determining symptom will be symptoms that are coming or aggravating on the approach of storm or during a storm or in a wet weather. Rhododendron has got that rheumatism aggravation from storm. Yes, there is, but other symptoms like loss of memory, words are omitted while writing, forget what he is talking about, has to think a while before he can recall it, mostly connecting it to their delirium. But I wouldn't say you to remember this for an exam purpose. There is vertigo and confusion, and this can be also given for Meniere's disease because there is an intense degree of tinnitus associated with vertigo because there is an intoxication. So we can think this remedy for Meniere's disease. Pain in rectum, which is extending to genitals. The male generative organs or the male sexual organs are more affected. The scrotum shrinks, testicles are retracted, or else they may swell, especially at night, and there are a seat of bruised pain, as if they had been crushed violently. So that symptom is very important. Don't forget in case of rhododendron. These pains are aggravated by touch, by sitting, and amelioration moving about. Menses are too early, too profuse. Menses reappear soon after they have ceased. And they also says one prover, rhododendron restored the menses after 6 months absence. And it has cured cyst in the vagina and also has caused the rupture of an ovarian cyst. But though I read it in the clock, I have never seen rhododendron given for this purpose of menstrual irregularity or the suppression of menses. I have not seen it clinically being given, but I have seen one of my teachers giving this for pain in testicle. Whether he had gonorrhea or not, or after effects, I don't know. But I just remember rhododendron being prescribed, and the complaints he had was rheumatism. Along with that, the testicle complaint. So rhododendron was given to him. Then the drug relation, it is antidoted by bryonia, camphor, clematis, and restrox. Camphor, I'm not sure of, but bryonia, clematis, and restrox, we saw the similarity of those drugs. Comparison with all the remedies belonging to the Ericaceae. Ericaceae family is ledum and this is the other family medicine, Calmia. It belong to the Ericaceae family. So most of the Ericaceae members, they are good for rheumatic complaints. That is why the comparison has come. Yeah, Calmia and ledum. Aggravation from wet weather changes, rest, amelioration, motion. And in case of restrox, restrox affects periosteum more than the rhododendron. Rhododendron, amelioration commencing motion, and restrox, there is aggravation commencing motion, but continued motion amelioration. Aggravation from wine, we have zingamet, and stormy wet weather, dulcamra, natrum sulf, nux mosquita. That's all for today.